From BBC, COVID, pizza workers live for South Australia lockdown. South Australia decided to enter a statewide lockdown based on a lie told by a man with COVID-19 about his link to pizza shop, police say. The strict lockdown began on Wednesday after the state detected 36 infections, including its first locally occurred cases since April. But this would have been avoided if the man had told the truth that he worked shifts at the shop, officials said. He said he only went there to buy a pizza. This misinformation prompted health officials to assume the man had caught the virus during a very brief exposure and that the strain must be highly contagious one. To say I'm fuming is an understatement, said Premier Stephen Marshall told reporters on Friday. Australia has relied on lockdowns, widespread testing, and aggressive contact tracing to push daily infections close to zero. We are absolutely livid with the actions of this individual, and we will be looking very carefully at what consequences there are going to be, Mr. Marshall added. South Australia Police Commissioner Grant Stephens initially said the man was unlikely to face charges because there was no penalty associated with telling lies. But he later announced a special task force would be set up to look at the circumstances surrounding the incident and investigate whether any laws were broken. State officials said they would lift the lockdown on Saturday, 3 days earlier than planned. After recording only 3 new cases on Friday, police didn't identify the man, but said he worked at the Woodfield Pizza Bar in Adelaide. Sydney Morning Herald newspaper reported that he worked with a security guard who contracted the virus at a quarantine hotel at the center of the outbreak, which prompted South Australia to go on high alert on Monday. When asked by reporters if the shop may need extra security because of public anger, Mr. Stephens said, "There are all sorts of things we are considering at this point." The state's outbreak follows neighboring Victoria's success in crushing a second wave of coronavirus, which caused about 800 deaths. Victoria has recorded 21 consecutive days of no cases or deaths after its capital, Melbourne, emerged from a strict 4-month lockdown. Australia has recorded about 900 deaths and 28,000 infections in total. Wow. How Melbourne lockdown crushed a second wave. In Australia, 900 deaths because of corona. Wow. COVID. Melbourne's hard-won success after a marathon lockdown. Melbourne's grinding second coronavirus lockdown began in the chill of winter. In early July, the nights were long and dark, and Australia's cultural capital was confronting the terrifying reality of another deadly wave of infections. More than 110 days later, experts say it is emerging as a world leader in disease suppression alongside places including Singapore, Vietnam, South Korea, New Zealand, and Hong Kong. Raina McLintre, a biosecurity professor at the University of New South Wales Kirby Institute, told the BBC that Australia's response had been light years ahead of the US and the UK. It's just truly shocking. When we think of pandemics, we don't think that well-resourced high income in countries are going to fall apart at the seams. But that is exactly what we have seen, she said. At the end of Tuesday, Melbourne's 5 million residents will see an end to strict stay-home orders that put an entire city into a type of protective custody. When the restrictions are lifted, Melbournians will have endured one of the world's longest and toughest lockdowns. It's been controversial, calamitous for jobs, and crushingly hard for many, but health specialists believe it has worked. There is cautious optimism that with very low case numbers, the worst is over. I'm pretty proud of what we have achieved here, said Professor Sharon Lewin, director of the Doherty Institute in Melbourne. The outcome has been extraordinary, not without its pain, though. On Monday, Melbourne reported no new daily cases for the first time since June. In early August, it was recording more than 700 daily and dozens of people were dying. The Victorian state capital was the heart of an unfolding public health crisis, and in the other parts of Australia, which had mostly contained COVID-19, people held their breath. Europe and the US are facing enormously high numbers. In Victoria, we had an isolated outbreak pretty much just in Melbourne, and the rest of the country had extremely low, and in many states, zero numbers, Prof. Lewin told the BBC. We had absolutely no choice but to go into a significant lockdown if we were going to rejoin the rest of the country, and it gave us motivation. Face covering became mandatory in Victoria, and a nighttime curfew blanketed Melbourne. Life retreat indoors. While on the front line of an invisible war, a growing number of casualties include healthcare workers and nursing home residents. The true impact on mental health may never be known. We understand why the government has taken that approach and it has worked. But we do feel that the government could move quicker to start easing the restriction. They are taking an overly cautious approach, explained Adel Salman, Vice President of the Islamic Council of Victoria last week. The strain of families, the rise in domestic violence, these are all concerning factors. In a global pandemic, Disease control strategies vary from country to country. A key part in Australia's defenses has been its geography. This is a large, isolated island. In March, it closed its international border to foreign travelers to stop import infections. Almost 8.5 million tests have been carried out in Australia since the pandemic began. More than a third have been conducted in Victoria. We've done extraordinarily well on testing, Prof. Lewin told the BBC. The capacity to do follows. The capacity to do follow-up tests and isolate became harder as the numbers peaked in Melbourne. But we have really good systems now in place, and that has been a secret to the successful outcome. Another expert, Michelle Toole, brought in the conversation. Only Vietnam and Hong Kong have enjoyed comparable success in quashing the second wave. Victorians' sacrifice during lockdown has left Australia well placed to sustain very low numbers of cases through the coming summer, said Prof. Toole, an international health specialist at Melbourne Burnett Institute. But serious mistakes have been made. Wow. Citizens and permanent residents are allowed to return to Australia and on arrival they face 14 days in mandatory quarantine. But security breaches at hotels in Melbourne allowed the virus to pass from passengers to staff and into the community, igniting a deadly second wave. These failures are being examined by a judicial inquiry. There were criticisms too that Victoria's health service was under-resourced when the crisis hit, and that is the early stage contact tracing of non-infection was indicated. Capek, I'm tired. Wow, that's a big. Ooh. We can't just go into denial and wish our life were back to normal. It's a once-in-a-lifetime natural disaster of catastrophic proportion. We can't just go into denial and wish our lives were back to normal. It's a once-in-a-lifetime natural disaster of catastrophic proportions. So, coronavirus means catastrophic.